Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. In this video, I would like to share with you some alarm warning signs of cancer for which urgent evaluation is usually required. Now, I know I spend a lot of time criticizing the medical and healthcare system for good reason. It deserves criticism. And trust me when I tell you that you will never meet anyone who is more skeptical of the system than me. I'm a physician myself, and I do not trust the healthcare system. I do everything possible personally to avoid any interaction whatsoever. I do not want to go anywhere near the healthcare system and become a patient because I know what happens next. Having said that, I am grateful that it's 2024 and not 1724. I'm sure you are all as well. It is a blessing to be alive today because there are some medical interventions which can cure people which were unthinkable only a few decades ago. And with regards to cancer, we are seeing rates of cancer go up across the Western world. And I can't tell you the number of times as a doctor working in the hospital, I see people come in with vague complaints and we'll do a scan and we'll find something absolutely horrible, a tumor or cancer which has spread, and we'll speak to the patient and they'll say, yes, I haven't been feeling well for a few months, or this happened 6 months ago. I thought it was nothing at all and it kept getting worse. And we'll realize that something terrible was going on for a long time. And of course, cancer can occur at any age. But I would say, particularly at an older age, there is only a very small window to reverse something, to cure it, to nip it in the bud. And that's why it's paramount that if any worrisome symptoms occur, especially out of the blue, they are checked out as soon as possible. And I want to share with you in this video some alarm signs and symptoms of cancer for which urgent medical evaluation is usually required. Number one, unexplained unintentional weight loss. People will have the same appetite or even be eating more, and they will be losing weight. This is always something which requires urgent medical attention. You shouldn't be losing weight unintentionally. This could go with a number of different cancers. Number two, a change in appetite. Nothing else would have changed in the environment, but people find that they're just not as hungry. They're eating less. They're not feeling right. That's something which you definitely want to get checked out. And linked to that is another symptom that I see frequently, abdominal bloating. Assuming nothing else has changed and you have the same appetite, if your abdomen is bloated and distended, that needs urgent medical evaluation. Number three, persistent fatigue. Usually this occurs over only a few weeks. You're not the same person you were. You lack energy, you just want to sit down or lie down. You are a shadow of your former self in only a short amount of time. Even if you have no other symptoms, no pain, please get that checked out. Number four, a change in bladder or bowel habits. Everybody has their own routine. If this abruptly changes out of the blue, that is something that needs investigating. Number five, persistent pain that doesn't get better. There's no history of trauma, but you have pain and it's getting worse. It could be in your abdomen, could be in your chest, could be in an extremity, in your arm, leg, in a bone, could be a headache. But it's there, you've never had it before, you can't see any visible abnormality, and it keeps getting worse. That needs to be checked out. Number six, a new or changing skin lesion. If you notice something for the first time, assuming there's no trauma, you haven't cut yourself, and especially if it changes in a short amount of time, if it changes color, it grows bigger, it could be a mole, it could be any other type of skin lesion, then that's something that you definitely need to make a quick appointment for. Number seven, a persistent cough. You've never had it before. It's not similar to an allergy. It might be associated with some other worrisome symptoms like coughing up blood. That's a big red flag sign that needs urgent evaluation. Number eight, bleeding from somewhere else. We just mentioned coughing up blood, which is a very alarming sign, but bleeding from anywhere else, particularly when you go to the bathroom. If this happens, then you need to get checked out very, very quickly. So those are some of the most common alarm signs and symptoms for cancer. And when I talk to patients and it's obvious that their cancer started a long time ago, those are some of the symptoms that they will report to me. You know your body. If something is wrong, then you should go and seek medical help. And if you aren't getting the right type of help, or God forbid, a doctor is not listening to you, then either be a little bit more pushy or very pushy, because this is a very serious issue, or find another doctor who will listen to you. Cancer is an absolutely devastating disease, and usually there's only a small window to pick something up early enough that it can be treated successfully. But in 2024, we can do more things early than we could a few years ago. Thanks everyone for watching. Dr. Suneel Dhand. Let me know your thoughts down below. Feel free to share your stories. Check out my Health Academy and my Uncensored platform. Those links are down below, as is a link to my free newsletter. If you're not already signed up for that, please do so down below. Hit the like button if you like this video and the bell button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. We will speak again next time.